Hello, everyone. Yeah, welcome back to this episode of our YouTube channel where we always dive into the most interesting issues that affect our mind, our body, and then our well being. We know you've been following us for this far, but don't forget to subscribe, to comment, to like, and then to share our videos. Today's episode, we'll be looking at one of the most interesting issues in mental health, and I know you've already come into contact with it, which is depression. We know depression goes beyond just a feeling of sadness. And today we are going to find out. Joining me in this episode has always been our friend, our doctor, our clinical psychologist, neuropsychologist, a lecturer at the Department of Education and Psychology, University of Cape Coast. Doc, it's another good time to meet you again.
Thanks for having me, Hub.
Yes. Doc, today's episode, we want to look at depression. Depression. It is a language of many Ghanaians. When you're going through breakup, people just have a thought that, oh, I'm going to be depressed. Maybe you've lost the loved ones. Maybe there's a financial struggle. We know that depression is really a language that is affecting a lot of people here in Ghana and even beyond the context of Ghana. So, Doc, as a clinical psychologist, can you educate us when we say depression, what is it?
Well, first of all, let me make the point that depression is a mood disorder.
Right.
When we say it's a mood disorder, we are talking about the fact that it's a disorder of your feelings, of your emotion.
Okay.
That's why we say it's a disorder of your mood of disorder. It's a disorder of your emotion. So depression is something to do with your emotion or your feelings.
Okay.
Now, when someone is depressed, we are talking about persistently that person is feeling very sad. Underline my words, persistently feeling sad. Persistent feeling of sadness in that person's life, right? And there's also lost interest in previously enjoyable activities.
Okay.
So when we say persistent, we are saying that it has to be for a long time.
Okay.
That's the distinction between sadness and depression. Depression is also sadness, of course, but it has to persist for a long time.
Wow.
Of course, it also comes with some other symptoms that makes depression broader than just feeling of sadness. And some of the symptoms are this. The person is feeling guilty. The person is feeling worthless. Now they don't have any value. They feel useless.
Okay.
They have lost interest in previously enjoyable activities. Right? They are sleeping excessively or sleeping very too little. Right? And so on and so forth. So there are some other symptoms like feeling of guilt, feeling worthless, excessive sleeping or sleeping very little. All these symptoms come together with the persistent feelings of sadness before we can say that the person is experiencing depression. Of course, it has to be manifested for over a month and more before we can say that, okay, you are going through depression.
Wow. So, yes. So, I think you answered my question. I was about to ask the duration to which an individual could be diagnosed of depression. That is a month or more. Like, so, Doc, someone is depressed. Perhaps he really can't figure out the cause of his depression. There are a lot of issues surrounding him. As a clinical psychologist, what could be those potential causes that can lead an individual to depression? Are there experiences that triggers depression? Yes, we want to find out from you.
So depression,
Okay,
pretty much has to do with the events that we encounter in this life.
okay,
Before we even talk about the events that can bring someone into a state of depression,
okay.
let's talk about the biochemical basis of depression. And we have the understanding from science or research that when you have some neurotransmitters in your body imbalanced or not at the level that they have to be in your body, so neurotransmitters like dopamine, neurotransmitters like serotonin, when they are not at the level or the threshold that they have to be within your body, that is when you feel depressed.
Okay.
That is from the biological explanation.
But to our viewers, maybe someone watching us doesn't know what dopamine actually does and serotonin. Just a brief. What does dopamine or
Of course, we can't break down.
Yes, just a simple.
We are just saying that they are neurotransmitters.
All right.
Right? They are in our body. They are just they transmit information in the body. That's what we say neurotransmitter. They transmit information from your central nervous system to the brain and back and forth.
Okay.
That's what we say they are neurotransmitters.
All right.
So they are chemical substances. So this chemical, which is called serotonin and dopamine, if they are not at the threshold, at the normal level that they have to be within your body, that is when we feel depressed. But that's a biological explanation to it. What it means is that when psychiatrists try to treat depression, they will try to give medication that will bring these neurotransmitters to that level, to the threshold, right? To where it's supposed to be within the body, right? Optimum level. Then people start feeling good again. Unfortunately, that feeling, the drug doesn't keep that balance there for long. It goes down again and they have to take the medication again to feel better, right? So that is the biological explanation for why people get depressed. Let's come into our lives. There are so many events that can make people depressed. When you have financial problems, when you've been divorced by your wife or by your husband, relationship breakup, you've lost a loved one, you try to do business with money and you lost all the money, right? Someone insulted you. You failed an exam. You apply for 1,000 jobs, you've not got any. So all the bad things that happen to us in this life are things that can send us into depression.
I see.
Of course, to a large extent, might also depend on how we interpret it in our mind.
Okay.
The fact that someone was divorced, the person will go like, divorcing means that I'm not handsome, I'm not beautiful, I'm this and that and that. That's why the person divorced me.
Yeah.
That can send the person into depression. So negative thinking can also make someone depressed. The events that happen to us in our lives, if you think about them negatively, it will send you to depression. For example, if you apply for many jobs and you're not getting, and you say that it means that I'm not good. If I'm good, they should have employed me.
Yeah.
That negative thought can send you into depression. Wow. So these are some of the causes of depression as you ask me.
Okay. So Doc, is depression really, or let's say, does it really affect a certain group of demographics or age group within our system? In terms of you being, witnessing cases for long and as a researcher in clinical and neuropsychology.
Depression affects all the age groups.
Okay.
Children, adolescents, young adult, older adults.
Wow. So children could be depressed.
Of course.
There
are a lot of mental challenges that children go through, especially African children, that we've not really been serious about.
Okay.
Yeah, they go through depression all the time. If a mother or a father should say something bad to the child, you are not nice, you are not good in school, you are this, all these negative things that we say to children gets them into depression, just that they don't even know that there's something called depression.
Wow.
Right?
So that could be traumatic too.
Of course. Saying trauma, it means that when they are being traumatized, sexual abuse and all of that, sending children into trauma can lead them also into depression.
Wow. So we have a video on trauma that you can check it out for your information. So Doc, sorry to cut you short. So are there other causes too to depression aside the ones that you've laid, the biological, the psychological? You talk about lifestyle. Yeah. What about psychological too?
What about people who have been diagnosed with chronic mental condition, chronic physical conditions,
physical health conditions,
diabetes, the stroke, and many other conditions, as people know. Yeah. All these conditions can definitely send people into depression.
I see.
All we are saying is that depression, beyond the biological explanation that we give, which is the neurotransmitters, not being at the normal level, things that happen to us in this life are the things that send us into depression.
I see.
Right? That is all I want to say.
Wow. So the things that happens to us in this life are the very things that send us into depression. So Doc, we want to find out, people would be very happy about this topic, but they are really looking at how they can be able to resolve their depressive moods. Yes, or the effects that it can really...
That's enough far effects.
Okay, so Doc, we want to find out some of the effects that this depression can have or impact people's life. Are there any, destructive effects that depression can have on people's life?
Of course, depression has a lot of effects on our bodies, Okay, in terms of our mental health, depression is a risk factor for many other mental health conditions like depression and like stress and anxiety, and many other. Even depression can also lead to psychosis. That mental condition where people lose their sense of touch with reality, and they'll tell you, I see things, I hear things, and all of that. So in terms of mental health, it can lead to other mental health conditions. Okay. In terms of physical health, when people are diagnosed with diabetes, chronic illness, especially the high blood pressure and all the conditions that they get depressed at the same time too.
Wow.
So we talk about comorbid, right? Meaning that it exists with other physical health diagnoses.
Okay.
The diabetes, the strokes, the cancers, and all of that. When people go into such diagnosis, they get depressed too, right? Meaning that to even worsen this physical health condition, the other person has been diagnosed with. You understand what I'm saying? Yeah. And depression is also known to impact on our brain functioning. When you are depressed, you can't even remember the things you want to remember. You can't even concentrate when you are doing a job. It's difficult for you to converse or chat with a person who is depressed and for them to follow through the conversation.
That's true.
It's possible because depression impacts on some brain structures in our heads. Right?
Yeah. Wow, interesting. Yeah, so Doc, as far as depression is concerned, there's a rise in cases and people are really much interested on this topic, and perhaps they want to find out solutions or interventions that could help them recover out of their depressive mood. So as a clinical psychologist, what is this, solutions that you can provide for individuals out there to adopt and that can help them improve or curb their depressive mood?
Well, so we'll talk about how depression is treated or managed.
All right.
So the first thing, quite often, because there's a biochemical explanation that neurotransmitters like serotonin and dopamine, they are not in the right level, and that is why people are feeling depressed. And so there are dozens of medications that have been made to try and bring this neurotransmitters to the optimum level, and therefore make people have reduced symptoms of their depression. So there are a lot of antidepressants, drugs that have been produced to help people reduce their depression symptoms, which psychiatrists usually prescribe.
Okay.
In as much as they are good, the depression comes back almost always,
Okay.
because they don't treat depression 100%. They help you to reduce the symptoms of depression, right?
Yeah.
What is really important is to address the root causes of the depression.
Okay.
What is really making the person depressed? And for me, I say this, that it's the negative thinking. The way we interpret the events that come to us in this life. Someone lost a loved one.
Okay.
They go into depression, you give them medication, good. But are they going to take the medication for life?
Long time. Yeah.
And have they dealt with the negative thoughts that they are having, that they lost a loved one? Someone will lose a loved one and say that it's my fault. I should have done something. If I did it, the person would not have died.
I get you.
Right? These negative thoughts have to be corrected through therapy, which a clinical psychologist will do.
Wow.
Right? Someone gets divorced or break up with a partner and they say that, because I don't look nice, because I don't have money, because I'm worthless, because I don't have a future, a bright future, that's why the person left. This negative thinking is what will send the person into depression. So we need therapy to help us address the negative thoughts. Or you as a person can actually list all the negative thoughts that you've had about whatever event that confronted you. And then you begin to see that these were really bad ways of thinking which has sent you into depression.
Yeah.
There are so many negative thinking styles which send people into depression. We have catastrophizing. In catastrophizing, people overblow, what they see. It's a catastrophe. I have failed the test. I'm dead. That is the end of my life.
Okay.
So another time we'll talk about some of the negative thinking styles that send people into depression. So big thing to deal with in depression is to check your negative thoughts.
The negative thoughts.
Now, there are many other things that you can do which will help your mood become better. One of them is regular exercise. Because we've come to understand that exercise releases chemicals which are good for the body, which will help to balance your mood and make you feel better.
Okay.
So exercise has been shown to be as effective in reducing depression symptoms as medications. Another thing is also to ensure that you are getting the adequate amount of sleep. And that is a tricky one because depression makes people sleep very little or sleep too much. Sleep shouldn't be too much and also too little. Then optimum for night, which is 7 to 8 hours, they need to try and get it during depression, because we've come to understand that there are studies showing that when you're able to get adequate amount of sleep at night, your depression symptoms reduces, right?
Yeah.
Having a balanced diet is also very important when people are going through depression.
I see.
Fruits and veggies, they have many antioxidants and nutrients that helps to reduce the depression symptoms, right? So many things can be done. Alcohol, if you are someone who take alcohol, if you want to get out of depression, you have to stop, because alcohol has been shown to be a risk factor for depression. There are many people who take alcohol who are actually going through depression.
I see.
Cutting alcohol, your mood becomes better.
Okay.
Same with cigarette smoking, also a risk factor for depression or mood disorders. Cutting smoking or any other substances would ensure that your depression symptoms go down.
Wow.
Another thing that we've seen in recent studies is that elsewhere in abroad, many people get depressed because they live in a weather where sunshine vitamin, which is vitamin D, is very less. Come to Africa. In Africa, we have sunshine almost all the time. It explains why people in abroad tend to get more depressed than people in Africa.
Wow.
Because we are blessed with the sunshine vitamin, which is vitamin D, and we get the highest source of vitamin D from the sunshine. So when someone is going through depression, it's good for the person to make sure that they are getting adequate amounts of sunshine so that their body can get some vitamin D, and therefore they will feel better.
Wow. 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 Today's episode has been a very informative, educative, and an interesting one. We've been talking on depression with Dr. Daniel Mienza, a clinical psychologist and a neuropsychologist at the Department of Education and Psychology. If you didn't hear anything at all, what you should take home is that you need to take care of your mental health very well, because depression is a killer disease to our mental health. Thank you for joining us, and see you in our next episode.